Hello, I'm Joseph DuPaul. I'm the director, lead therapist for 5D Cancer here in St. George. I originally landed here in St. George in 1980. Ended up getting a job at McDonald's and met my wife there. We were both managers. Later on, I worked at a facility out in Green Valley called More Business Forms. I was in the printing, and I was doing that for 19 years till they closed the plant. After they closed the plant, I had to decide what I was going to do. So I ended up starting back into college. 16 years since I had graduated. Started with my Associate of Science here at Dixie State University. Finished that and went on into Weber State up north. Traveled up there for school. Total of about 7 years. I got my bachelor's in radiation therapy. I originally was hired over at another facility here in town, a hospital here. And down about 12 years after I was there, Dr. Ray Richards decided to open up a facility here. It was called Gamma West Cancer. He asked me to be the director lead therapist for this building here. So I ended up over here, and we were here till December 31st of 2023. And then the facility closed, and I ended up working at one of our old facilities in Salt Lake City, St. Mark's Hospital. Was there for 3 years, traveling up there on Monday and coming home on Friday. I have 3 children, all married. I live here in St. George, and my wife's worked at the school district, Washington County School District, for 28 years. She's retiring this year. So I was given the opportunity to come back here with Dr. Richie Stevens, and I'm grateful to be home. I have 3 wonderful children, and they've seen me go through school. While I was going through school, we had this huge oak table in the dining room, and for 7 years we never ate dinner there because all of my schoolwork was there. And the kids knew you don't go near that table at all. And it was tough because, I was 16 years post-high school. I graduated in 1979. When I graduated, I'm embarrassed to say I think I graduated with a D+. But my full collegiate career I carried a straight 4.0. And it taught me it's all about putting your mind to what has to be done. My kids were wonderful through the whole experience. They helped me study for my boards. If I got sidetracked, my youngest would say, "Pappy, come back on over here. We got to get this done." Come and sit down. Growing up, we did a lot of camping here in southern Utah. But hobbies is my family, and helping them and taking care of them. I have a daughter and 2 sons. All of them are married with homes here. My daughter has 3 grandsons. My 3 grandsons are with them. They're 10, 8, and 7. The 2 youngest are special needs. The 8-year-old, he's in 2nd grade. He tests on a 6th grade level, but he has autism. The youngest is 5, and he was born blind. And my daughter had COVID in her 3rd trimester with him. So he and the middle child, grandson, they both have special programs they're in, along with school. The youngest has been going to a preschool for 3 years now that teach Braille and walking with a cane, and he's going to progress to kindergarten this next year. They're just wonderful. They're the light of my life. And it's funny with disabilities, a lot of times people use that as a crutch, but my daughter, and as with the rest of the family, there's no disabilities in life. There's only abilities. And that's how we live life with them. If you can't figure out how to do it, then we need to sit down as a family to figure out how to take care of what you need done. As far as my family goes, they're my life. That's why I'm so grateful to be back here in southern Utah. Well, I've been in the medical field since 1999. That's when I first started. It's 2026, so we're looking at, 27 years. And what inspired me to do it was the fear of not being able to get a job that was going to pay my bills and take care of my family. When I went back to school in 98, I had 3 children, and they were 5, 8, and 11. And my wife was working part-time in the school district, so I knew I had to do something. And I started back to school, and it's just turned out to be the best thing I've ever done. And I just fell into everything that I'm here. I didn't know anything about radiation therapy. I didn't know what it was. I had a good friend that was a dosimetrist and manager at the facility I started at, and he called me and asked me what I was doing. So I told him, I don't know what to do. I've been looking and honestly praying about what should I be doing. This all just fell into my lap. And here I am, and I wish I would have done this when I was 19. So Southern Utah has been kind of a niche. I've been here since 1980, and the community was small enough that we knew everybody. And if we didn't know everybody, we were related to them. And now, of course, you know, it's grown from 26,000 people to about 166,000. So I still do know a lot of people in the community, and a lot of them I'm related to. But being here working in the community has been great because in this profession, you get to meet a lot of people. And in that time frame that you're with them throughout their treatment, a lot of times they come in and they've been diagnosed with a disease process, could be cured, and sometimes it can't be. When it's not able to be cured, we call that palliative, and we're treating them to give them a quality of life so that they can still live their life without having to be cared for. And knowing these people, I mean, I still see people all the time. I've seen so many people, a lot of times you see them with no hair, and then all of a sudden 6 months later, they're like, Joe. And I'm having to stop to think, who is this? Because they look so different. The care that we give to them, and they are always so thankful by the time they leave, because this is a really frightening experience for a lot of people, and by the time they leave, we've just loved them into their treatment and loved them out the door. Well, when I first started treating back in '99, we were treating on, it was an old dinosaur. It was an 1800 linear accelerator. We had to create Cerebin blocks for shielding. So if you had a 4-field prostate or an 8-field, they'd have 8 blocks, and the doctor would have to design it on X-ray films, and then we would pour blocks to shield them. One of the greatest things that has happened throughout this whole time that I've been treating is what we call the multi-leaf collimator, the MLC. When the doctors are planning a treatment, they're able to sit down and digitize to the patient's scan that we've done on the CT and simulation, and they're able to digitize what they want treated and digitize what they want shielded. So it's nice that we don't have to lift those, you know, some of those blocks were 60 pounds, you know, putting them up into the head of the gantry. And it's also made it a lot easier, and the treatments have become so tight as far as treatment. On the old 1800, a lot of times they were treating through, partially through the spine that they didn't want to hit. With the new technology that we have, they can actually take that planning session and they can treat completely around the spine all the tissue that needs to be treated, but not treat the spine, which is huge, huge. Well, my role in 5D Cancer right now is to, first of all, make sure that the clinic is running completely as well as it can, making sure we have all the medical supplies, all of the machines have been calibrated and taken care of. But as far as a patient is concerned, when they first come in, the doctors already spoke with them through the consult and explained to them the pros and the cons and what can happen. So typically, as a therapist, we will reiterate what the doctor has told them. And a lot of times you just have to, I keep falling back down into this. It's all about loving people and just letting them know that we're here for them. And we genuinely do understand what they're going through. But throughout this whole process, I could give you many examples of people that we've helped, and a lot of times you'll get patients that might feel like they're claustrophobic and don't want to be pushed into the tube, and you just have to talk to them. You have to explain to them, look, the process for your disease process for treatment, we have to do this. We have to find a way for you to go somewhere happy in your mind to get this treatment completed. And you just have to reaffirm and talk to them. And like I said, I keep saying, you just got to love them, you know? And that usually does the trick. After a while, they're calm and they make it through their treatments. Lots of hugs and thanks. And when you see them out in public, Same thing over and over again. Well, I would explain to them that the technology that we have is the finest that there is now, and it's only the only second one here in the United States. Being able to adjust the treatment planning as we are treating is a big plus. As a therapist, whenever you're scheduling people, for instance, in the last facility I was at, we were treating anywhere from 16 to 30 patients at a time. And when you're putting them in 20-minute slots, you know, as a therapist, you have to come in an hour, hour and a half early to get the machines all warmed up, do the daily QA on them before you even start treating. But when you have a patient that comes in and their bladder's not full enough and you've got to get them down to drink more water, or their bowels are full, you've got to get them down to have a bowel movement, or if they've got gas in their rectum, you've got to cath them to release the gas and then have to re-image them. It sometimes runs into more than 20 minutes, 30, 35 minutes, and a lot of times when you're treating a load of patients like that, we're treating from 6 o'clock in the morning to 6 o'clock at night, and you're there until the treatments are complete. It gets a little difficult when things like that happen because patients come in, and of course, if you've got a patient that's following another patient and they've got a full bladder and an empty rectum, a lot of times they've got to void their bladder and then start drinking water again because we've been pushed behind. And there's no way to just catch up with these treatment machines. Everybody's treated the same, and you just take it one step at a time. I would tell them that one of the best things about this machine also is the fact that we could essentially take, say, a 32 fraction treatment and move it down to 5 or 7 days if need be, which is nice because in southern Utah here, we typically have people that we see from all surrounding states here. So we get people from Arizona, we get people from Nevada, we get people from northern Utah because they don't want to fight the traffic. We get people that are coming here for treatment, and the least amount of time that they have to stay away from home, the better it is for them.